I'm Nicole Hunt. I'm a doula here in Sioux City.
And I'm Mallory Hertz. I'm a doctor of physical therapy, and I specialize in pelvic health.
Okay, so I'm gonna try not to throw anyone under the bus here.
Like yourself?
Myself included. So I went on a trip with some family members and we were running. And when we were running, maybe perhaps the rain wasn't the only thing making other people's articles of clothes wet. Okay, so one of the family members I was with, who has 5 children, was like, "Oh yeah, I wear Depends. I leak all the time."
How old is she?
She at the time was less than 50.
Okay.
So she was telling me how she leaks all the time, and in my head I'm thinking, okay, I don't leak that bad, but I leak. I leak when I run, I leak when I jump, I leak when I work out. And so then in my head I'm thinking I should look into this pelvic floor therapy, because as a doula I've heard about it and I hear
it's like on the edge of your your knowledge base.
Yes, it's like where the ocean meets the beach. It's like, well, that's as far as I go now.
Yeah.
And so I found you and I'm like, okay, I don't want to be at 50 years old wearing Depends.
Right.
And so I was a little bit more proactive, because I'm like, Mallory, I don't want to be that woman. So how can I fix the little incontinence that I do have with like stress induced, like coughing, sneezing. And I've seen it. I've even seen the meme on Facebook where like they show the woman crossing her legs sneezing, and it's like, and it's like, oh, if you're doing this, you're a mom. And it's like, now I know, because I'm on the other end of that's not, it's common, but it's not normal, like you say.
Yes.
So maybe touch on that a little bit.
Yes. So what you're talking about is called stress urinary incontinence. So it's leaking that happens with stress situations: coughing, sneezing, lifting, jumping, running, exercising, drop zone, sky zone, right? All those.
Don't be that mom on the sidelines at drop zone. Just jump with your kids, but do PT first.
So stress incontinence is very, very common, but it's not normal. Incontinence is never normal. There should be something that we can do about it. So in my professional experience, a lot of these issues are stemming from childbirth. Either you're gripping in pregnancy and then you forget after birth that you don't need to grip anymore because the pressure is gone, but this gripping becomes your new normal. So sometimes you're so tight that when you demand those muscles to work, they have no room to work. So that's sometimes where stress incontinence comes from. But a lot of times what I'm finding is that as the baby passed through and those muscles spread out, because remember, inside our pelvic bowl, this pelvic floor muscle goes around the urethral and the vaginal opening, right? So this muscle has to spread in order for that baby to go through the pelvis.
Gotcha.
So a lot of times post-birth, I'm finding that this muscle is still sitting wide. It's still sitting out there.
Okay.
It hasn't come back together. And so it's not supporting the organs like it should. And there's this extreme weakness. So when you cough, sneeze, lift, the pressure from the top that you're creating
like
in your abdomen, it's putting so much pressure on your bladder, and then your pelvic muscles don't have enough strength to hold anything back. So I would say the pressure from the top is greater than the closing pressure from the bottom, and then you leak. And usually it's just drops, usually. Right. Now, it might be more than drops if you have several sneezes in a row or if you have a coughing fit. But in general, this stress incontinence is just a little bit of leaking. So if you can address this
early on,
postpartum, or the earlier the better.
Right.
We can get those muscles back to where they should be and stronger, so that they do have enough closing pressure to hold back when the stress situations happen. Now, in this family member that you're talking about, she undoubtedly, this probably happened to her in birth, or after giving birth to one of her 5 children, maybe even number 1, and those muscles never came back like they should, but she had enough residual strength everywhere else through her hips that she just kind of held things together until she got older and her hormones started to change and her muscles started to fill with fats, just a normal part of aging. And then it becomes a problem that she can't control because she's lost her residual strength that she was using to kind of hold herself together. since the issue started. So it is my professional goal to be able to address all women in the postpartum era. So I don't have to see them when they're 50, 60, 70 because they've been healed and they're functioning and moving forward. So we can still treat them at that stage, but it's more ideal to treat them in that acute stage.
Yeah, and one of the interesting things that I learned is you can actually like be, like I don't want to say heal your incontinence, but you can address your incontinence and have additional children and then still bounce back from that. And I know we talked about the pressure bouncing back, but like literally the body's resilient enough that you can bounce back from the incontinence issue that you had from childbirth. And that's actually a thing you can do.
Yes, absolutely. And a lot of times it's gaining strength in that muscle. It's getting the muscle to sit back where it should and be able to function like it should.
Yeah.
And just your body doesn't necessarily naturally do that post birth.
Right.
And that's where the gap lies. That's where we need to step in.
Right. And then long term, without addressing it, without doing the PT,
then the muscles not only sit wide, but they get really, really thin. And so then they've got nothing. They don't have strength and they don't have.
So it's easier to do like in your 30s or.
I just say like in the post birth era. So like, because that's when the injury occurs, right? Is during birth, everything widens out, allows the baby to pass, and we can bring those muscles back together.
Okay, instead of waiting 20
30 years
and then you're.
It's still possible, but by then the nerves are weaker, the muscles are weaker, and so it can take a little bit more work and more time. In the postpartum phase, when women come in, we might see them once, twice, 3 times. They can be pretty independent. Therapy doesn't mean twice a week for 10 weeks.
No, you do a lot of it at home.
Yeah. So much of it is our assessment, educating you, and just letting you roll with it. Yeah. So if you come in that post-birth era, you can get better faster. Okay. But if you're coming in your 50s, 60s, 70s, it might take us a little bit more time and a little bit more work.
Yeah, it's interesting. Yeah, definitely glad I did that. Not knowing that, how quick you can bounce back. Yeah. So look at me, I can jump around a drop zone, and
that's right.
I'm like a walking testimony that pelvic floor therapy is like, it's real, it works. It's not just, I don't know, it's not a mythological creature.
And it's not just kegels.
Yes, it's not just kegels.
It's more than that.